case study for patient number 1. He's a 63-year-old Caucasian male. He has worsening numbness, tingling, and burning. The worst thing is really that burning sensation that he has. Pain level he describes as a 10 out of 10. He's currently taking gabapentin, pretty low dosage, 100 milligrams BID, which is not helping. He states that the pain has been worsening over the past 6 months since his back surgery, and it's worse at nights. His EMG and nerve conduction study did not show any significant damage to the large nerve fibers. His medical history includes diabetes mellitus, type 2. He, of course, has severe back problems, hypertension, and hypercholesteromia. As far as his social history, he denies smoking, drinking, or any kind of illicit drugs. So for his diagnosis, we did the ENFD test in the office without any complications. As far as the results, so remember we mentioned we want to see about 10 millimeters, 10 fibers per millimeter on the test. So if we're above 7, we're in that normal healthy range, and the less nerves we have, the more severe disease we have. So on the right side, he only had 2.5 fibers per millimeter, so described as moderate neuropathy. And on the left, he only had 4 fibers per millimeter, described as mild neuropathy. And as we mentioned, normal values should be above 7. So we started him because he was in that mild to moderate margin. We started him on dietary supplements. He was taking 1 tablet twice daily for 90 days. He reported that he could finally sleep at night because he didn't have any more of that burning sensation. So now he continues to take the dietary supplements. He does take Lyrica PRN. I always give them that option in case, they've traveled, they're just having a bad day. They have some things to take, but on a daily basis, they're just taking those supplements. He's revisited at 6 months, and he reported continued improvement of the symptoms. And for patients like him, where they're having good improvement, we're not really redoing the test, I do like to recheck them every 6 months to make sure that they're staying consistent and we're not getting symptoms coming back or recurring. So I do like to recheck them every 6 months. Barely ever do I ever have to redo the test because most often they have improvement in their symptoms. But those rechecks really help kind of get them back on track sometimes.